Hello, Lee. I'm going to be your medical assistant today. Today I'm going to give an example of a finger stick. So first thing you want to do is ask your patient their name and date of birth, and then you want to review your orders. And so first I'm going to start out, I'm going to show an example of how to do a finger stick. So first what you want to do is you want to make sure your hands are cleaned and washed, put on gloves, and then you take your patient and you're going to use their ring finger, and you're going to take the alcohol and you're going to rub it on the alcohol. And then what you're going to do is you're going to take your stick you're going to insert your stick into your meter. By doing that, it automatically turns on your meter for you. And then I'm going to take the lancet and I'm going to poke my finger, and I'm going to slowly push and squeeze the blood up towards it. And what I want to do is I want to squeeze enough blood out, and then I'm going to wipe it, so because the first drop is contaminated from the alcohol. So I'm going to squeeze enough blood up there, and then I'm going to put it up there, and it's going to suck it up there. And the meter will tell me it's doing it, and then it'll stop, and it'll suck it up, and then it'll give me my reading from there. And so that's how you do your glucose meter reading. And now I'm going to show an example of how to do a finger stick procedure.
After you've identified and greeted your patient, be sure to have him or her wash their hands with soap and warm water, then dry with non-recycled paper towels. With small children, ask them to clasp their hands together to avoid touching things until ready for the finger stick. The pinky side of the ring finger is a good choice for finger sticks. By holding the hand as shown, there is good management of the patient's hand and lower risk of infection, as this is not a grabber finger. Cleanse the finger with alcohol using back and forth motion. Place the lancet such that it crosses the fingerprint lines to get a better droplet of blood. Puncture the finger and wipe away the first droplet of blood. It is contaminated with alcohol and tissue fluid. Turn the hand downward and using gentle side-to-side squeezing, not top to bottom, which will block blood flow to the fingertip, allow the blood to free flow onto the filter paper card. Do not touch the blood drop to the card before it falls. Do not shake the blood drop to get it to fall from the fingertip. This is what standardizes the testing from one collector to another. It's a bit like target practice and takes patience for the blood to fall to the card. If you happen to miss the center of the circle on the card, skip the next circle and move to the following one. The minimum specimen volume for testing is 2 drops of blood. Once you're finished, place gauze, not cotton, according to the newly updated standards of practice for phlebotomy, on the site and ask the patient, parent, or guardian to hold pressure on the finger. Discard your lancet into a sharps container immediately. Label the card with the patient's name and date of collection. Show the card to the patient, parent, or guardian to be sure it's labeled correctly. Cards must be allowed to dry for a minimum of 4 hours before being placed in the zipper baggies for shipment to the Indiana State Department of Health Laboratory for testing. Talk to the patient, parent, or guardian about the necessity of a bandage. These may be choking hazards for very small children.